What is up, YouTube? Welcome back to my second video. I'm Rose, I'm 42. I've had my right hip replaced, and on Wednesday, 3 days away, I am going to have my left hip replaced. I'm actually in a lot of pain. I haven't been able to take any pain medications except for Tylenol, and honestly, Tylenol does nothing for me. So I've just decided to skip out on it and kind of detox my liver and kidneys, get my body prepared for the surgery. But in today's video, I'm going to be going over some of the equipment and tools that I used for my recovery, some of which are required, and others that I purchased on my own that I've watched other YouTubers who've gone through hip replacements said that, these things would help them. So let's get into it. Okay, let me tell you a little bit about these fancy looking things, starting with the most important. One is your walker. This was provided to me by the hospital. However, you can purchase these on Amazon. I've seen them for like maybe 30, 40 bucks. They also come with a basket. I didn't have a basket when I had my right hip replaced, and that was one thing I wish I would have gotten, but I also didn't want to spend 40, 50 bucks on one. However, I came up with an idea of just buying a Dollar Tree basket and zip tying it to the front because I don't plan on being on the walker for more than a few weeks. Also, a chair. Now, they wanted you to have some sort of sturdy recliner or a chair that you can sit in with good support that doesn't allow you to go past 90 degrees when you're sitting because they don't want you to dislocate your hip. So if you can see, it's kind of at an angle. Now I'm 5'3", so it's just a couple inches taller than a normal dining room chair. And I love this chair. To this day, I still use this chair. I use it as a vanity mirror chair, and I use it as my computer desk chair. So I purchased this on Amazon for, I don't know, I think like 20, 30 bucks. So it wasn't too bad. All right, next fancy thing, the toilet seat cover. I did not want a bedside commode. I insisted on walking to my bathroom and using my own toilet that I can flush. This I did not purchase. It was gifted to me by a friend who knew I was looking for stuff for my surgery, and he came across this. So thank you, David. And again, it just gives some elevation to your toilet seat so you're not straining to go down too low and too far past 90 degrees because you will be extremely weak and sore. And that little gray knob, basically, when you twist it to the right, it tightens and then locks it into place so it's not moving around and you're not sliding everywhere. So makes me feel like a baby when I'm using that. But hey, anything to help me during the first couple of weeks. All right. The fourth one is your shower chair. I don't really need to go into detail about that. I purchased this on Amazon. It was like 20 bucks, I believe. You will need one of those. And another thing for the shower, you will want a shower head that has a detachable handheld device. And I also purchased like this removable adhesive sticker, I guess, and I put it on my wall because I wanted to be able to place the handheld at a position where, like when I'm sitting, the shower head can just drop right down on me instead of just letting it dangle down. So the shower chair is preventing you from falling. Again, you don't want to stand up in the shower after a surgery, such as a hip replacement, and then slip and fall. So I also got these little shower stickers that gave some grip to the floor. So again, you're not getting up and slipping and falling because we don't want falls. That's a big no-no. Another thing that you're going to want to use in the shower is this thing, a handheld shower brush with the long handle. I seen some of those products that were in those hip replacement toolkits. I personally did not like it. The hospital gave me one again, and it was really flimsy. Like it had no structural strength to it. So when I went to use it, it was like bending and it wasn't even cleaning my body. So I recommend getting a nice durable brush. This is my sock tool device. This thing is so funny looking, but it really helped me out when I put my socks on. So basically you just put your sock on, and there's this little padding right here that holds your sock in place. And once it's on, you hold this like a jump rope, one in each hand, slide your foot in it and pull it towards you, and it works like really well. I was surprised. Okay, next one, your grabber. That was my best friend. These you can purchase on Amazon. I seen them for like 15 bucks, I believe, but this came in a packet that the hospital gave me. So if y'all don't get your tools or supplies, your hospital may provide it for you. They did charge me. It was like 20 bucks for the package, but it was a lot cheaper to get all this stuff in one package than it was to buy them separately on Amazon. This thing, like I said, my best friend. I can't tell you how many times I was dropping things and I couldn't reach them. Hi, Boots. All right. Once you get off the walker, you're going to graduate to a cane. I got this off of Amazon. It was on sale for 7 bucks. I used that while I was, progressing through physical therapy and learning how to walk around the house. One other thing that I used, you'll probably get like a gait belt like they gave me with the walker. But once I started physical therapy, they were using a yoga strap, and I love this yoga strap. I got this off of Amazon for like 5 bucks, I think. But I like it because it's got these little hoops in it. And just like a gait belt, you would strap it around your foot and then use it to help lift your leg up onto the bed. Now, it's not required to buy, but it helps me out. All right, I'm going to show you how this yoga strap works. Again, they'll probably give you a gait belt, but this I prefer. So let me take my slippers off. You're basically, again, I'm 5'3". I just put it down to like the second loop, wrap it around the bottom of my foot, and then scooch back and lift. And that really helped because your leg's going to feel like it weighs 1,000 pounds. Again, I wanted this. I prefer this over the gait belt. Ice packs. You're going to need at least 2 to 3 of them. Got it from Amazon. It was like 10 bucks. Not sponsored. But don't forget the ice packs, y'all. Oh, the Hygge mat. Now that fancy thing is an electromagnetic field mat with infrared lighting. I purchased that on my own. Felt like I needed it to, reduce some inflammation in my body and promote healing. Now this video is not sponsored, y'all. Like I said, I purchased everything all on my own. This thing is extremely heavy. So when you're in your first couple of weeks of recovery, get somebody to help you open that up and set it up. For my second surgery, I'm just going to leave it on one side of my bed because it's just me, y'all. So I'll sleep regularly on one side, and then when I want to get up to do some electromagnetic therapy, I'll just slide on over to the other side of the bed, turn it on, and then sit there. I don't know much about the other brand, but the reason why I purchased this one was because it was half the price of the other brand that's out there. And in comparison, the materials that it's made out of is exactly the same as the other brand, the really expensive brand. The only difference is for the long length one, the large size one, theirs was like, I don't know, 1,200 bucks, and I got this one for like $6.99. So, and again, the materials were the same. Let me grab the Hygge mat. This thing is, again, super heavy, y'all. Ugh. The first couple of weeks, get somebody to help you out if you're going to be using one of these. Let's see. Comes in this little fancy case. You got your plug. But what I do once I get it on the bed, and then opens up. You can lay it flat, or I like to sit it up. So plug it in, turn it on. The infrared heating goes for about 12 hours, and the pulsed electromagnetic field usually runs for about 20 minutes. And like I said, this has helped me tremendously. This, if y'all know about PEMF therapy or pulsed electromagnetic field therapy, said to reduce inflammation and help wound healing. It helps patients with osteoarthritis and grounding. This is also a grounding mat. I use it for grounding and meditation. I love this thing. Again, not sponsored, but love it. A couple other things. Get you some sweatpants or anything with an elastic waistband. I lived in these things. They're so comfortable. They're easier to move in, and you're going to be doing physical therapy. It's just, again, easier to move around in. Make your room comfortable. Get some books to read. I made a few playlists on Spotify because music really helped me. And I think that's it. Yeah, I like my sweater. My friend made it. Super cute. I don't know if you can see it. Okay. Without further ado, y'all, I will make my meal prep, my post-op meal prep video soon. Then I'll be having my surgery. Thanks for watching again. Bye.